Hello, everyone, and welcome back to Let's Talk About It. In this episode, I'm going to talk about occipital nerve block from a patient perspective. Again, my name is Colleen Neal. I suffer from occipital neuralgia and also vestibular migraine. I had an occipital nerve block, I guess it was about 5 weeks ago. And I want to talk a little bit about first, why would you have that kind of nerve block? Two reasons. One is diagnostic, and one obviously is for pain relief. So let's talk about the diagnostic part first. I did a video just recently on what occipital neuralgia is and all kinds of information pertaining to that. Let's go over the anatomy a little bit, because part of it is you need to rule out other things if you're having pain in the back of your head. And one of the ways that you determine if you actually have occipital neuralgia is to actually have a nerve block. So let's just kind of review real quick the anatomy and the three nerves that lie on either side of the back of your head that we're talking about. So here, actually this, you see some, this is an image that I chose that relates to an occipital nerve block. Anyway, on either side of your head, on both the left and the right side, you have three of these main occipital nerves, and occipital meaning the back of your head, the posterior part of your head. Here you have the greater occipital nerve, and you'll notice you have this main large nerve, but they branch out. Each one of these, they branch out, throughout the back of your head. And just so we're clear, these nerves are between your skull and your skin on the back of your head. They're not in your brain, around your brain, or anything like that. You don't use them for cognition, motor skills, anything like that. These are sensory nerves. So you have the greater occipital nerve here. You have what's called the third occipital nerve here, and then what's called the lesser occipital nerve. So you see they really kind of originating down here, in the neck area, and then they kind of branch out, around the back of the head. To some degree, you see the lesser one is, kind of, back near your ear, and kind of goes around the side of your head, temple area. The greater occipital nerve, you see that's branching out really towards, over to the top and crown of your head, and even, up into your forehead area. And then you see the third occipital nerve is more towards, the center of the back of your head. So when you're talking about getting, a nerve block, part of the reason that doctors do that is to say, okay, do you have occipital neuralgia, or do you potentially have something else going on here? So if you are, if they palpate this area, and they're saying, oh, this is where it hurts, doc, it hurts. And then they go in and they do, let's say, an occipital block right here in this lesser occipital nerve on this side of your head, and it's effective, and you have pain relief there, then, that's a way for them to say, oh, okay, that clearly could be a strong possibility that this is what we're dealing with, right? So for a lot of people, and certainly for me, that's exactly why we did it. For me, I have this bilaterally. 1/3 of patients have occipital neuralgia on both sides of their head. Some have it just laterally. Again, everybody's different, and they get occipital neuralgia for different reasons. Like I said, for me, I got it from car accident. It was trauma to the head. Some people get athletic injuries. Some get it, just from constantly looking down. And again, something we've got to think about with kids, especially like a lot of these kids are growing up, they're constantly looking at their phones, constantly looking down. I think that's something we have to think about, is, how can we, get kids, their neck to be, looking up and looking forward. Anyway, that's another whole discussion. But anyway, so number one is diagnostic, right? And then the second reason why you might have this nerve block is for pain relief. So for me, thank God, it worked both ways. So had it done. It worked. I did have relief. And so we're going to check both boxes, right? So yes, it worked. So yes, occipital neuralgia, boom, boom, boom. And yes, pain relief, thank God. And then we're going to talk about that. So we talked about where your doctor will work with you and talk about, okay, which nerves are we going to hit? What side and how, so you'll talk to your doctor about that. So how's it done? So for me, I had it done in my doctor's office. Now, I don't mean like your regular exam room where you're like just sitting in the regular room having a chit chat. It's not that kind of exam room. And it's also not a surgical center. Your doctor might do that, but my doctor did not. It doesn't really require that. I've had cervical and back nerve blocks. That's a different situation. That's a surgical center. This isn't. So however, my doctor had a setup where it was a larger room and there was like a long table. So you had to lie down. So I had to go in there, lie down. You don't have to suit up or anything like that, but they need access to your neck. So you do have to lie down flat on your belly. And you could, obviously they need access to your neck. So I had to lie down flat and then had to have the ability to drop your neck down kind of at the end. If you imagine laying down at the end of your bed and dropping your head, off the edge of the table so that your neck is extended and the doctor has access to your neck and the back of your head. So that's, I had to, kind of hang my hair over so they had access to to the back of my head. So that's what we did. There's a nurse there, an assistant there. So the doctor prepped the area, of course, alcohol, cleaned it, all that kind of thing. And then I knew in my particular case, we were going to hit all the nerves, the 3 on the left, the 3 on the right. So I knew that going in. And that's a discussion that you would have. So you're prepared. Are you getting 6, you getting 3, you getting 2? Like, how many nerves are we doing here? I'll tell you, from start to finish, 15 minutes. It's not a long procedure at all. So the first thing they do is they go in with a lidocaine or some kind of numbing agent. Needle's not that big, but it's big enough to inject that. So they inject next to the nerve in that space, numbing agent, because they're going to put another needle in deeper to release, steroid or whatever they're going to put in there for the nerve block agent. And that's going to be deeper. It's going to hurt more. So they're going to put lidocaine in to numb it up. So it's not going to hurt as much for you. So that's the first medication they're going to put in. It's not bad. I mean, it's a bee sting. It's, it's there. It's going to hurt a little bit, but not bad. So for me, it was, the one nerve, the second nerve, the third nerve on the left, the one nerve, the second nerve, the third nerve on the right. And then we waited, you want to let that kick in, let kick in a little bit. So it numbs it up a little bit. So, we waited, I don't know, 2 minutes for all those to kind of kick in a little bit. And then they're like, all right, let's do the nerve agent. So that is a little deeper. Everybody, so listen, A, I'm not a doctor. So let's say that this is my personal experience. And B, everybody has a different tolerance of pain, right? So my tolerance of pain is different than your tolerance of pain. It's not bad. It's not bad, relatively speaking. When I'm in there, I always go, I'm in Jamaica, I'm in Jamaica, I'm in Jamaica, I'm in Jamaica. That's kind of how I tolerate stuff. It's pressure. It's more pressure than pain, I would say. I don't care about needles. They don't bother me. But it's a pressure, right? It doesn't hurt as much going in because you're numbed, but you do, of course, going to feel the pressure from the agent going in to a closed area. But it's not too bad. So some of it is kind of down in your neck area, actually. Some of it's there. Some of it's a little further up in the bottom part of your skull. But it's not like up here in your head. You're not getting shot up here. It's kind of lower. And they'll talk you through that. So it was, 1, 2, 3 on the left, 1, 2, 3 on the right. And they let me kind of sit for a minute. And they're like, all right. And literally Band-Aid. That's it. Not bleeding, nothing, right? So the biggest thing they were worried about is me getting dizzy. And it was like, all right, get up slowly. And I was a little dizzy because my head was hanging kind of upside down a little bit, right? For probably 10 minutes while they were doing that stuff. That was the biggest issue. So I got up a little slowly. They asked me what I ate. I was like a banana, and they were a little annoyed that I didn't eat more, but I was like, I didn't want to eat more. And that was really it. So I took my time getting up. I have vestibular migraine, so my balance is crummy anyway. Because of vestibular migraine, like my brain senses kind of the world like I'm on a boat. So, I sway anyway. So, that was a little weird, but otherwise I was fine. I did have my brother drive me, and I think that was wise because I didn't feel great. Like I felt just like, yeah, a little sore. I felt dizzy. Nah, not great. Just a little off. I probably could have driven. I don't think I would have been in the danger zone if I drove, but I just felt like, I feel a little queasy. I just felt a little nauseous, probably from feeling dizzy. But it was just nice that I didn't have to worry about driving. So other than that, how long did it last? It's funny. I asked my doctors beforehand, hey, how long do you think I'm going to have relief? They were like, they totally weren't telling me. And it's probably good because I didn't have any expectation. I searched around the internet to see what I could find out, and everybody had a different story. Different doctors had different things. I'll tell you, for me, it was 2.5 weeks. I felt good. Like I was like, oh my gosh, I could touch my head, I could lie down. Like I literally didn't have pain. Like I went to the movies. I still had to wear earplugs and stuff, but like I kind of like, oh my God, I don't have like really, really bad head pain every day. It was kind of awesome. And then like it started to creep in, like not bad, but I was like, ooh, okay, I'm starting to get really bad headaches, but like not all the time. And it wasn't, well, I don't want to say really bad headaches, maybe like 50%. And then it was like 80%. And like now, what am I? I'm a month out, I'm 5 weeks out. Now it's game on. Now I don't have any relief. It's game on. So definitely 5 weeks out, there's no difference. So it was a short-term thing. I'm going to the doctor next week. So they knew, right? They knew because they scheduled me 5 weeks out, 6 weeks out for my next appointment. So they knew, I think they knew that I was going to wear off. So I'm going to meet with them this week and coming up here, and we're going to talk about what are the next steps, right? Again, you have a couple choices. I kind of know what mine are, but you could do radio frequency ablation, which is burn out the nerves. Again, you can burn them out because they're sensory nerves. I've had that done in my lower back before. They grew back in like 18 months or so, anywhere between 12 and 24 months. I'm not really interested in doing that. What I'm really looking for is occipital nerve decompression surgery. I know they can do like some nerve modulation stuff. My doctor hadn't talked about that. I'm hoping that's the conversation we're going to have, but we'll see what the doctor recommends. As I said, if we do the occipital nerve decompression surgery, I'll totally take you guys on the ride. Beforehand, what I learn about it, my prep, whatever that looks like. Obviously, not gonna be able to take you in the OR, but I'll take you for the ride, even the ride home, and my recovery. But I'm going to do it if I have the opportunity because occipital neuralgia it's for me. It's very painful. I have it bilaterally. I have it in all 6 of those nerves, and like right now it's Saturday. It's, I don't know, 4 o'clock. I've been putting off doing this video. I had to go to lay down probably 4 times already today. I've had to ice my head twice. I'm having a really hard time with the lights right now. I have a hat on a little bit because of that. I will ice my head after this video. Yeah, I can't really function. I can't work. I have trouble thinking. I have insomnia. Sometimes I have trouble eating because nauseous a lot just from the pain. I don't really go out socially. It's really hard for me to do that. And I don't want to do that. So I don't really, it's not like really something you can really function with. So for me personally, if I have to have a surgery on these nerves and look down, down the road at even a 6 to 9 month recovery, sign me up. So anyway, I'll let you know what happens with the doctor next week, and whatever the next steps are, I'll take you on the journey with me. So thanks for joining me, and lots more of things to talk about. So have a great day, and I'll see you in the next one.